everyone. Thank you so much for taking time to be here with us. If this is your first Urban Institute, I think I've seen almost all of you, if not all of you, before an Urban Institute session. But if this is your first time, welcome. Just like to thank all the attendees. So if you took time here, but also this really great partnership that we have with Urban Institute. So Olivia, Selena, your entire team, and our facilitators today. I won't steal any thunder from Reina in introducing our facilitators, but Greg, Dulce, Dr. Blake, really excited to have you here, and it's been great ramping up to this really, really great conversation. So I just want to share that today the discussion will include discussing trends, pressing trends and issues related to health, including barriers to healthcare, links to economic security, immigration, and well-being, and recommendations for policymakers interested in advancing health equity. And I do like to just say that these sessions, I think these are some of the most unique sessions that we have here at FUSE. They're designed really to speak to the cross sections of what our fellows are doing in the field, what our alum are doing now. Some around 50, just over 50% still in government or social service, some in public, some in private. And then our community partners, if we have any on the call today, but our government partners are also very much welcome to be here and are also dealing with and working with some of the most important issues in our cities and counties across the country. But with that, I will also now pass it over to our Senior Associate of Programs, Reina, to introduce our facilitators today.
Thank you so much, Dan. We are thrilled to welcome our facilitators today. We're joined by Gregory Acs, Dulce Gonzalez, and Dr. Hassanatu Blake. Gregory Acs is Vice President for the Tax and Income Supports Division at the Urban Institute, where his research focuses on social insurance, social welfare, and the compensation of workers. Previously, he served as Unit Chief for Labor and Income Security in the Congressional Budget Office Health and Human Resources Division, and as Vice President of the Association of Policy Analysis and Management. His recent work examines economic and social mobility and economic security with a focus on low-income working families. Acs has a PhD in economics and social work from the University of Michigan. Welcome, Dr. Gregory, and then Dulce Gonzalez. She's a Senior Research Associate in the Health Policy Division at the Urban Institute. She forms part of a team working on Urban Institute's Well-Being and Basic Needs Survey. She conducts quantitative and qualitative research focused primarily on the social safety net, immigration, and barriers to healthcare access. Her work has also focused on the impacts of the COVID-19 pandemic on non-elderly adults and their families. She holds a BA in economics from California State University, Long Beach, and a master's degree in public policy from Georgetown University. Welcome, Dulce. And then lastly, but not least, Dr. Hassanatu Blake. She's a global health leader whose broad work and current focus is at the intersection of digital innovation and health equity, and supports the transformation of health in marginalized populations and hard-to-reach communities globally. As Associate Clinical Professor and Director of the Global Health Undergraduate Program at the University of Maryland, she prepares the next generation of public health leaders through an interdisciplinary curriculum emphasizing global experiential learning, world languages, and digital innovation. She also advises initiatives nationally addressing health disparities, appointed by Maryland's Governor Wes Moore to the Maryland Healthcare Commission. In 2023, Dr. Blake shapes policies to improve healthcare quality, access, and equity across the state. She's also a FUSE alum and served with the city of Birmingham. Welcome, Dr. Hassanatu Blake. I'll pass it over to the Urban Institute team.
Thank you. And if we could advance the slide, would be great. Schedule for the day, and we are only 3 minutes behind at the moment, so that's great. Next slide, please. So thank you very much for inviting me to speak with you today about our work at Urban, looking at the true cost of economic security. Next slide, please. We were approached to develop a measure of true economic security, to identify a measure of the true cost of economic security by the Federation of Protestant Welfare Agencies and the Community Service Society of New York. And their goal was to have us develop a measure that goes beyond poverty. Poverty is sort of a subsistence measure. We wanted to have a measure that captures all the costs that families need to be economically secure financially resilient and poised to thrive. So what does it really take to feel that you're not just getting by living paycheck to paycheck, but you made it, you can save for the future, and you can move forward? Our goal was to capture all the resources that families have to meet the cost of economic security, and to allow, and recognizing that costs are going to vary by location where you live. It's more expensive to live in San Francisco than in Birmingham, Alabama, for example. And by family type, a family of 6 needs more than a family of 2. We wanted to build a measure using high quality publicly available data sources so people could replicate the measure and modify it to suit their needs. And we didn't just want to sit in our lovely offices, or home offices as the case may be, and develop this measure. We wanted to make sure that it resonated with people. And so we did, with our colleague, Selena Barrios-Milner, who's working with you at FUSE, we had focus groups of people and ask them, do these costs resonate? Does this make sense to you? And took their feedback into account. So next slide, please. Thank you. So what can we use this measure for? Well, it'll allow us to see how many people in the country are struggling economically. It'll let us examine differences by, demographic characteristics, type of family, and also place. It'll tell us why different types of families are falling below the true cost of economic security threshold, what costs are important, what resources are important. And ultimately, we hope it'll help identify policies at the local, state, federal level that can support and empower families to help them meet the true cost of economic security and be ready to thrive. Next slide, please. So a little bit of nuts and bolts in the structure of the talk. First, I'm going to talk about how we built the cost side, the threshold cost for the true cost of economic security. Talk about the resources we're able to count and capture. We'll look at how thresholds vary by different family types and places. Then we'll talk about the rates of people who fall under the true cost of economic security. And just to note, when we started this work, the best available data we had was for 2022. So everything that I'm talking about today reflects 2022. We do not have trend data. We are currently working on the 2023 version, which should be out by the end of the year. Next slide, please. So we didn't have to start completely from scratch. There are many efforts around the country to look at what is a living wage, what is a self-sufficiency standard, what's the cost of living. Most notably, United Way's ALICE measure, MIT's living wage calculator, among others. But what we did essentially is we looked at what they did. We picked and chose what we thought were the best practices, best data sources, best thresholds, added a few things of our own, and came up with our economic security measure. So let's talk about the cost side. Next slide, please. So for the cost elements, we want to capture the cost of housing. And essentially what we're doing is looking at what fair market rents are to assign how much you need to spend in housing to be adequately housed. We do, however, want to avoid crowded housing, so we made sure that children of different sexes had their own bedroom, especially once they got above the age of 12. So housing is first, food is second. The official poverty line uses what's known as the thrifty food plan. We didn't want to be poverty. We wanted to be a notch above poverty. So we look at food costs based on the low cost food plan, which we can also adjust by place, by county. Huge cost for families is healthcare. There are two components to healthcare: the cost of health insurance and out-of-pocket costs. For the cost of health insurance, we said, fortunately, we have ACA marketplaces, the Obamacare marketplaces, and we said, you need to get at least the second lowest cost silver plan. That's how much your health insurance costs. You need to be prepared to spend that much to have adequate health insurance. And for out-of-pocket expenses, we looked at data on out-of-pocket expenses in the current population survey and did a computation to do out-of-pocket costs onto families in our data. For childcare costs, we use the median cost of center-based care based on data from the Department of Labor. Transportation cost is the cost of car ownership and public transportation for families at the 88th percentage of average median income in the area. In today's society, you need to have broadband and a cell phone to fully participate, and we have a national level cost for that. We split out tax credits and taxes owed, so we have what you owe in taxes on payroll cost, your federal tax cost, and your state costs. We couldn't do every city for, around the country for those who that do have city taxes. Debt is an important, debt service is an important component of family costs. And we couldn't capture all sources of debt, but we could capture student debt. So for families who have student debt, we look at in their county on average how much they're paying towards their student loans. It's not how much they owe, it's how much they're paying per year towards their student loans. All sorts of other miscellaneous costs come up: clothes, cleaning products, the cost of public engagement. All that is reported in the Consumer Expenditure Survey, and we use data from the Consumer Expenditure Survey to set thresholds for our true cost of economic security measure. And finally, we feel it's important for people to be able to save, either for a rainy day, for their kids' education eventually, for their retirement. And so we set a savings target of 10% of all your other costs that you have to meet. So you have to meet all the costs we think you need to meet, plus 10% more. Why 10%? Well, we figured in 5 years that would get you to 50%, which is about 6 months worth of precautionary savings, which is what financial planners tell you you need. And then beyond that, you can start saving for other purposes. So those are the cost side. Let's look at the resources that we're counting. Now, the underlying data for our work comes from the American Community Survey, and with some enhancements from our microsimulation model, ADIS, at the Urban Institute. I'll tell you a little bit more about that in a moment. So resources are pretty standard: your annual earnings, your self-employment income, interest, dividend, rents, pension income, transfer program income. And we know that transfer program income is underreported in most survey data. The ADIS microsimulation model can adjust for that underreporting. So the amount that's reported in the data equals what the government is actually paying in those benefits. We also count child support received. We put tax credits on the resource side, so the earned income tax credit, the child tax credit. Employer or government sponsored health insurance. So we don't know exactly how much you're getting or what the value of Medicaid or Medicare is or what your employer is paying. But we do have a cost side. We figure if you have insurance that's being provided from your employer or from the government, it just fully offsets the cost of that health insurance. So that's how we treated health insurance as a resource. And then childcare. Some families have have multiple adults, and one of those adults is not working. If that non-working adult is present with a child under age 12, we assume that that person can provide childcare, and so we count that homework as a resource to cover exactly what we think is the childcare cost. All right, let's put these things together a little bit. This is where the slides often crash. Let's see what happens. The overall, we find that 58% of people living in families with children, and all the adults in the family are under 65, that 58% of those people have resources that fall below the true cost of economic security. Let's look at cost by cost. Housing costs for these families is a little over $18,000 a year. Healthcare costs a little over $20,000 a year. Food costs almost $13,000 a year. Transportation costs $15,500. Childcare costs $11,400. You add it all up, and the threshold, how much money you need if you're in a family with children and no adults over 65, is about $135,000 a year. The median resources for these families, about $121,000 a year. So on net, more than half the people in these families do not have all the resources they need to meet the true cost of economic security. Let's look at some other families. So if we look at families where there are no kids and all the adults are under age 65, you can see costs are generally lower. They're smaller families. On net, you need about $89,000 to achieve economic security, and median resources for these families is about 92,500. So for adults under age 65 without children, 46%, a little less than half, are economically insecure. Let's look at families where adults are over 65. Not ready for the next slide, thanks. Older folk have higher healthcare costs. So you can see that in that black square. On net, their total costs are around $105,000 a year. Their resources are around $109,000 a year. So again, about 48% of older adults are economically insecure. Now, the reason their resources are relatively slightly above on average, their costs are, the importance of Medicare and Social Security for those folk. Next slide, please. Let's talk about two special types of families, three-generation families. So you have a person over 65, a working age adult, and a child in that family. Cost for these families is somewhat higher rent costs, higher healthcare costs. On net, these families need about $170,000 a year to be economically secure. Their median resources are around 160. So the share of people in these families who fall below the economic security line is about 56%, not that different from all families with children. And then last, want to look at families that have student debt. You may have noticed I mentioned student debt. Most families didn't have, the median family doesn't have student debt. Among families with children and student debt, the median student debt payment, how much is going out a year, is $2,000. The median cost for these families is about $144,000, and their resources are also about $144,000. So the costs are slightly higher for these families than other families with children, but their resources are also higher. What does that mean? Well, families with student debt also tend to have more education, and hence they tend to have more higher earnings. On net, again, about half the folks in these families are economically insecure. Next slide, please. We talked about, does place matter? It does, a little bit. Costs are higher in metro areas than in non-metro areas, particularly things like rent. But the people who live in metro areas tend to have higher resources. Now, maybe the higher resources lets them live in those more expensive areas. So on net, metro versus non-metro, not a heck of a lot difference in the share of folks who are economically insecure. Let's look at regional differences. You can see that the Northeast and the West are particularly high cost regions, and the South is a slightly lower cost region, but resources in the South are slightly lower as well. In the Midwest, costs align pretty well with resources. And you can see the regional distribution, the share of folks who are economically insecure, highest in the West, 57%, lowest in the Midwest at 47%. Let's look at some specific family types and the share of folks, demographic characteristics, and the share of folks who are falling below the true cost of economic security level. Children are most at risk. 3 out of 5 kids live in families whose resources are not equal to or fall below the cost of economic security. For prime age adults and older adults, that's about half. Next, across race and ethnic groups, rates of economic insecurity are higher for Black people and Hispanic people than for white people and for folks with Asian Pacific Islander backgrounds. Now, these differences reflect long-standing structural differences in where you can live, what type of education you get, where you can work. But we do see these persistent race and ethnic differences. Next slide, please. Finally, we wanted to see what is driving these differences. So we looked at high-cost regions and low-cost regions, places where lots of people are struggling and places where lots of people are thriving. And as you can see, the total costs are pretty similar at the median for places where people are struggling and places where people are thriving. What's really a big difference, however, is resources. In places where people are struggling, average resources, median resources are much lower than in places where people are thriving. So let me wrap up quickly. It may be too late to wrap up quickly, but let me wrap up. Next slide. So things to keep in mind, we're talking about 2022. We don't know about trends yet. We made a lot of decisions as to what are the precise thresholds. They may reasonably vary, and we hope we've given you enough information to think, are they too high, too low? How do they vary for different people? And it's challenging to capture all the resources and all the costs. For example, we do adjust for underreporting of public assistance programs. We do not adjust for a known underreporting in pension income. And also people who have owned their house for a long time probably get some value out of that. But to wrap it up completely, key takeaways are that over half the people in the US are economically insecure based on our measure of the true cost of economic security. Families with children are particularly vulnerable. Places with higher proportions of people struggling, it's not that their costs are particularly high, it's that the resources of the residents are rather low. So while it's important to bring down costs, particularly high cost items like housing and healthcare, and that's going to benefit everyone, we don't want to lose focus that it's not all about cost. It also is about how much families can earn. And so attention to families' resources is crucial if we want to have more people being poised to thrive. Thank you. And let me turn it over to Dulce.
Greg. So thank you. Next slide, please. Today I'll be presenting on results on material hardship among immigrant families with children based on the Urban Institute's Wellbeing and Basic Needs Survey. And just to give you a little bit of an overview of this survey, it is one that we fielded. We field at Urban, and we've started fielding it in December of 2017. And we've been fielding it every year since. The WBNS, which was what we call it for short, it was designed to monitor changes to individual and family well-being in the context of policy debates at the time, which was Trump 1.0. And there were a lot of discussions around that time about cutting back safety net programs like Medicaid. And so our survey was really designed to try to capture that context. And it's evolved over time, but it always consists of roughly 8,000 adults ages 18 to 64 in each round, and it's drawn from Ipsos's probability-based knowledge panel, which is the nation's largest probability-based online panel. One limitation of the survey is that it is only administered in English and Spanish, so it doesn't capture the experiences of people who do not speak these languages, which is one big limitation when it comes to our immigration work, unfortunately. But we do our best here. And some of the core topics that are included on the survey are topics related to well-being, such as food insecurity, health and healthcare access, housing, employment, safety net access, and participation. And we also include some topical modules that evolve each year based on the current policy context and sort of priorities within that. And then beginning in 2018, we began to include an oversample of non-citizens in the sample to capture the experiences of adults in immigrant families. And that's what I'm drawing on to present on today. And in the latest round of the survey, we received responses from just under 2,000 adults in immigrant families and who we define as adults who are either immigrants themselves or are living with one or more people who are immigrants. Next slide, please. And so as I present, I'll be talking or disaggregating results by 3 different categories of immigrant families. And so here I'm just giving you a super quick overview of what those families are and how they're defined. One is just a group of all citizen immigrant families, which is, as its name implies, it's just families where everybody is either naturalized or US born citizen. Second group would be people who are in families where there are only green card and citizen members. So everybody has a green card, everybody's naturalized or US born. And then the last category being mixed status families, which is just households where there's at least one person who is undocumented, and everybody else has some form of lawful status, such as being a US born citizen, a permanent resident, or something else similar. Next slide, please. And so here, jumping into the results of our most recent study on adults and immigrant families with children, here we found that almost half, or roughly 47% of immigrant families with children reported one or more of the material hardships that we asked about on the survey. And by far the most common hardship was food insecurity, with 34% of these families reporting this hardship. But also 1 in 5 adults in immigrant families with children reported problems with medical hardships, such as unmet need for medical care and problems paying family medical bills. And also 18% reported problems paying utility bills. Roughly the same with problems with paying the rent or mortgage, so those housing costs. Next slide, please. And so when we broke the results down by different family, immigration, and citizenship status, we found that perhaps unsurprisingly, mixed status families with children disproportionately reported that their households had experienced 1 or more material hardships. So that's those blue bars on this graph here. So 58% of these families reported any material hardship, compared to only, or roughly 37% of those in all citizen families and 47% of those in green card and citizen families. And this pattern held throughout all the different hardships that we explored. Next slide, please. And so here I'll pause briefly just to talk about some of the measures that we included on the survey that are relevant to immigration and hardship for immigrants. And so as we noted, mixed status families tend to have higher rates of hardship, and underlying those rates of hardships are systemic inequalities, such as undocumented folks being disproportionately concentrated in low-wage jobs, or potentially inability to access credit and challenges building wealth as newcomers to the country. And there's various reasons why this is the case. But one potentially big factor in shaping hardship for families is the context of immigration policies in the US. And so when we feel that the last round of the WBNS, which was right after the 2024 election and before the second Trump administration took office, we knew that based on the rhetoric that Trump, the presidential candidate Trump at that time was spreading, and based on discussions in immigration policy circles, we knew that there was going to be a massive crackdown on immigrant communities. We didn't know what that would look like, but we knew it was going to happen. And so in addition to the usual questions on avoidance of public benefits, which is that first bullet there that we've been asking over the last several years, we also included 3 new questions around people's worry about doing essential activities like going to the doctor, taking their kids to school, and questions around fear or worry about deportation and any steps that families were taking to prepare for immigration policy changes. Next slide, please. And so from these questions here, we first present families' avoidance of public benefits like Medicaid and SNAP because of worries about immigration. And so we found that close to 2 in 10 adults in immigrant families with children had avoided non-cash government benefits like these because of worry about affecting future green card status, either for themselves or a family member. And mixed status families with children were much more likely to report this avoidance, which we refer to often as chilling effects on public safety net program participation. And we don't show it here, but adults in immigrant families with children were more likely than those in families without children to report these chilling effects. So that's not shown here, but just wanted to highlight it briefly. Next slide. And here the slide looks very similar, but it's the findings here are about worry about visiting healthcare settings in particular because of immigration concerns. And we were interested in looking at this measure specifically because one, I'm in the health policy division, but also two, just knowing that avoiding healthcare settings could be detrimental to families' health. Children might miss out on child visits, immunizations, and the like, and even parents missing out on healthcare could affect their mental health, could affect their ability to access preventive care and things like that. And all of that is going to affect well-being in the long run. And what we're finding is, again, mixed status families being the most likely to report being worried about visiting healthcare settings because of immigration concerns. Next slide, please. And then when it came to deportation concerns, again, unsurprisingly, mixed status families with children reported the highest level of worry about deportation, either for themselves, a family member, or a close friend. But notably here, and what we like to highlight and what we want to highlight to folks is that this worry about deportation doesn't extend just to immigrant families. We see that 31% of green card and citizen families with children were reporting worry about deportation, as were, you know, families with only citizens, which were that 17% bar, that second bar there. So even before the second administration, the second term administration took place, families were still across immigration statuses, across citizenship statuses, were reporting this worry about deportation. Next slide, please. And then just to highlight some sort of more resiliency measures that families were taking, and regarding some steps that families were taking to prepare. So we asked, you know, what are you doing? What steps have you taken to prepare for potential changes in immigration policy and potential changes to status? And we found that nearly 1 in 4 adults in immigrant families with children had taken one of the steps that we asked about on the survey, which included things like seeking legal advice or, you know, renewing immigration status and things like that. And mixed status families with children were more likely than other families to report sort of taking these steps to prepare. Next slide, please. And so I'll wrap up by saying that children of immigrants and their parents are a crucial part of the economy and our communities, but aggressive immigration enforcement threatens their access to needed healthcare, education, social services, and just generally being part of the community. And all of that could impact health and well-being. As I mentioned before, you know, children can be particularly affected because of parental separation to detention, and that could affect their health and stability at a key time of development. And there's plenty of research showing, a lot of literature showing that even just the fear of and the exposure to enforcement can harm people and cause psychological distress, cause interruptions to needed health and social services, and affects children's health and education outcomes. And then again, policy impacts are not limited to people who are in mixed status families. And so, yeah, just something to keep in mind there. And then finally, there are, as we know, a lot of immigration policy changes happening right now that affect immigrants. Some of these are listed here, but it is by no means exhaustive. But there are things like, you know, data sharing between federal agencies, such as agreements between the IRS and DHS to allow for the sharing of tax data for immigration enforcement purposes. There's been recent legislation at the federal level that's going to strip many lawfully present immigrants of their eligibility for basic needs programs like Medicaid and SNAP. And again, so many more policy changes and practice changes here, but taken together, it's important to highlight that all of these policy changes could reduce and have reduced access to needed basic needs programs, basic needs programs and supports at a time when people are facing a lot of hardship and a lot of economic uncertainty. So thank you for your time. And now I'll pass it off to Hassanatu.
Good afternoon, everyone. I just want to say quickly, I like to thank Urban Institute and FUSE for inviting me to speak with all of you today. I just have a brief time to speak with you, so I'm going to focus on the paradox that we are faced with when it comes to health costs skyrocketing and also the root causes of poor health and as it relates to social determinants of health, right? So next slide. Some of the factors that have been discussed today, some of the data that's been shared so far has been really compelling, right? One of which that sticks out like a sore thumb is that 58% of American families with children cannot meet the average costs to achieve basic economic stability. And some of those costs include housing and food and healthcare. So communities that aren't able, families that aren't able to invest in these social determinants, whether you call them costs, needs, whatever, but social determinants, really struggle to see the positive health outcomes that we need and also to achieve economic vitality. So we are presented with a crisis, but I believe that we also are presented with an opportunity to invest in those social determinants in order to improve our health outcomes and really push some of that, some of those families into more stable situations. Next slide. Again, the Urban Institute did a really great job in highlighting how the health situation that we're in right now and how misallocation is really creating our economic instability in the United States. The current situation highlights how healthcare costs is really one of the biggest costs that families have to take on, with about 15 to 20% of the budget being taken up by healthcare costs. So really being able to understand that cost and resource availability is connected, and being able to invest in some of those factors to build resource infrastructure for families is really going to help us move from insecurity to stability. And I'm going to go into a little bit about how I am working to kind of address this crisis in a couple of different ways. Next slide. I'm going to share a little bit about some of the experiences that I have had, and I am going to touch upon my FUSE project and also what I'm doing currently at University of Maryland. So I served as a FUSE Executive Fellow in 2021 in Birmingham, Alabama, and I was working with the city's Department of Planning, Engineering, and Permits. And my FUSE project focused on addressing environmental injustices by targeting the root causes of those inequities through one of Birmingham's initiatives called Shape Birmingham. And Shape Birmingham is a tool that integrates equity measures into the planning process at a neighborhood level. So like many of you, I did my listening tour and spoke with so many different stakeholders across so many different sectors to really understand the landscape of Birmingham. And I was able to develop a 120-day Birmingham report based off of those findings, and then also formulate an operational framework for the Shape Birmingham initiative. These two documents actually set the foundation and contributed to a current initiative that is running in Birmingham, which is called Birmingham Sustainability Plan. The Department of Planning, Engineering, and Permits is working with the Office of the Mayor, where they are developing a sustainability plan that will serve as a roadmap to addressing environmental challenges in Birmingham and also strengthening the economic opportunities that will have a great impact in the quality of life and the well-being of its residents. So they are looking to increase housing security, but also reduce healthcare costs through a whole host of different measures. And right now, they are set to complete that plan in April of 2026. Next slide. Now, what I'm doing right now is actually leading the new Global Health Undergraduate Program and also overseeing our environmental justice major program at the University of Maryland School of Public Health. And I really have the pleasure in helping to train the next generation of health professionals so that they can really understand the global perspective on how economics and economic security addresses social determinants of health systemically. Our program is really interdisciplinary, and that's intentionally, right? We do that intentionally because we understand that in order to address resource gaps that we see in our health systems, we really have to make sure that our students and our learners have a really good grasp of working across different sectors, being able to design interventions that really speak to the economic value of communities. And then hopefully through these professionals and through these really informed health professionals, they're able to kind of push families that are in that 58% economic insecurity rate into a more stable situation. Next slide. So just to wrap up, I wanted to leave all of you with a couple of things to focus on. And that's one, being able to target high impact social determinants to really secure economic and health security. So I want you to think about addressing housing and education and all those different factors that can improve resource availability. And then two, really start to look at how do you develop a measurement framework so that you can better track the health outcomes with the economic indicators. And really do that over a course of time and generation, actually, so that we can really start to see how we improve families' economic security in general.